in the life of Susie, a case of pericarditis. This is a story about an ordinary person just like you and me. She lives a normal life with daily routines and problems. However, one event in her life, though she doesn't realize it yet, can actually change the course of her life drastically. It's almost 4 o'clock in the morning, about the time when Susie wakes up. She is in charge of their very successful family business, so she spends all her time making sure that nothing goes wrong with its daily operations. As she wakes up, she sits up and glances at her watch and frowns. She's a bit late. Then she coughs. She has a sore throat and it's a bit annoying. But busy Susie can't stop right now to pay attention to it. She has a hectic day ahead of her, so she reluctantly gets up. The day continues. Susie brushes her teeth and keeps glancing at her watch. She is worried that she's late for work. As she spits out the toothpaste, she notices that it's red. There's blood in her gums. She gets alarmed, but not too much, because she knows her gums always bleed every time she brushes. She finishes up and hurriedly prepares to go to work. As she goes about her daily routine, little does Susie know that bacteria already enter and invade her heart. It then does its destructive action. Soon after, Susie will feel its effects. The wall of the heart has 3 layers, the outer layer called the epicardium, the middle layer called the myocardium, and the inner layer called endocardium. The epicardium is the visceral layer of the pericardium. Now the heart has a covering made up of a thin layer of specialized tissues called the pericardium. The pericardium has an inner and outer layer with a small amount of lubricating fluid between them. As the bacteria starts to invade the heart, it now has a hard time pumping because of the inflamed pericardium. This condition, called pericarditis, happened when the bacteria, or more specifically, group A beta hemolytic streptococcus bacteria, which is a normal flora of the mouth, entered into the capillaries in her mouth. These capillaries opened up by the abrasions made by her sore throat and bleeding gums. Then, these bacteria traveled through the bloodstream all the way to the superior vena cava and entered her heart. Susie is on her way to see one of her clients. Suddenly, she feels faint. She has a hard time breathing. She feels a sharp, piercing pain in her chest. She starts to sweat. Slowly, very slowly, she goes down the steps. Then, she faints. Finally, Susie goes to a doctor to have a checkup. She tells the doctor that she has been feeling some chest pain for a few days now and has a sore throat. She also has fever and chills. The doctor takes a look at her throat and sees that it is inflamed. The doctor also listens to her heart and lungs to find out if there's any problem, as Susie is also complaining of difficulty of breathing. Lastly, the doctor asks a question to Susie if her gums bleed whenever she brushes, and Susie answers yes. The doctor explains that upon her assessment, Susie might have a heart problem. She then tells Susie to undergo a few tests, such as an electrocardiogram and an echocardiogram, to determine which layer of the heart is affected. She then advises Susie to come back for the reading of the result of her test. Susie agrees, thanks the doctor, and leaves. The doctor reviews the result of Susie's tests and diagnoses Susie to have pericarditis. She then gives Susie the necessary medication to relieve her pain and treat her condition. Susie feels relieved and hopeful. She has been given another lease on life. When the pericardium becomes inflamed, which is a condition called pericarditis, the amount of fluid between the two layers increases. This squeezes the heart and restricts its action. Because of this, a person has chest pain. The pain is predominantly felt below the breastbone and or below the ribs on the left side of the chest and occasionally in the upper back or neck. Breathing causes the lungs and heart to move in the chest and rub against the irritated pericardium, worsening the pain. Pain may worsen when patients lie down and may improve when they sit up and lean forward. Changes in position can increase or decrease pressure on and irritation of the inflamed pericardium. As for the treatment, analgesics or anti-inflammatory drugs are given to relieve pain. Antibiotics are also prescribed if the pericarditis is due to a bacterial infection. If excess fluid is seriously affecting the heart's action, a needle may be used to draw it off. In some cases, surgery may be required. Acute inflammatory pericarditis usually lasts 1 to 3 weeks and doesn't lead to further problems. About 20% of pericarditis patients have a recurrence within months or, rarely, within years.